Discussion on settings in an ECG machine and their practical importance. Recording speed is usually set to 25 mm per second. Higher speed recordings may be taken on demand at 50 mm per second. Much higher speed settings like 100 mm per second or 200 mm per second are usual with intracardiac ECG recordings during electrophysiology studies. That is for better delineation of intervals between intracardiac electrograms. Usual ECG recordings are calibrated with a 1 mV square wave pulse to yield 1 cm deflection on the y-axis. Double standardization or double voltage recordings can be made to visualize P wave better in some situations. The interval between various ECG waves and their voltages can be calculated only if the settings are known. Notch filter is meant to neutralize the 50 cycle interference due to the line voltage. In regions where 60 cycle alternating current is available, the notch filter will be set to 60 Hz. High pass filter allows signals with a frequency higher than the set value to pass through to the recorder, and a low pass filter will allow signals below the set value. High pass filter filters out respiratory variations which are of low frequency, while low pass filters remove high frequency artifacts like those due to electromyogram interference. Low pass filters may also remove pacemaker stimulus artifacts. Therefore, digital ECG may sometimes be inferior to analog ECG in detecting pacemaker artifacts. Now, algorithms are available to specifically detect and mark pacemaker stimulus artifacts. Pacemaker spike, being a high frequency signal, is effectively filtered out by the filter setting of 0.08 to 40 Hz in this ECG. Hence, this ECG is likely to be diagnosed as left bundle branch block at one look, though we are missing the P waves before each QRS complex, which would be expected in a simple LBBB with sinus rhythm. Pacemaker spikes are easily seen when the same ECG is repeated with a change in the low pass filter to 150 Hz. In fact, both atrial and ventricular pacing spikes are seen before each QRS complex with an interval in between marked by blue arrows. Hence, this person has a functioning dual chamber pacemaker. The paced P waves are either of low amplitude and hardly visible, or it could be lack of atrial response to atrial pacing, that is, atrial capture failure. This ECG highlights the importance of appropriate ECG filter settings for each case. Non-optimal filter settings can affect the ECG signal depending on the frequency of components. QRS complexes which have relatively higher frequency components are affected by low settings of low pass filters.